my name is Demi. I'll be the student nurse that's working with you today. Can you tell me your name and date of birth? Good. I saw you don't have any allergies, is that correct?
Yes.
So the doctor wanted me to come in here to start an IV on you, give you your IV antibiotics. So I'm just gonna wipe this table off and let it dry, and then I'll get my equipment set up. Okay. So I checked the patient's fluid status in Epic. I checked if they were on any blood thinners. That way, if I needed to, I could bring in extra gauze and equipment. I checked the patient's size and weight to see if I could gauge what type of gauge I would need when inserting my IV. And I think I could do it with a 20 gauge, but for practice reasons, I am going to be using a 24 gauge. I'm just going to get my equipment set up. And I checked, and all of my equipment is in good expiration. So I'm going to open my IV kit, get my tourniquet, my ChlorPrep, and have some alcohol and some gauze just in case. Then I have my dressing and a label, but we don't need that. I have my J-loop. I have my 24 gauge IV, and I have my flush that I'm gonna go ahead and attach to my PosiFlow so I can prime that right away. Okay. Go ahead and wash my hands, put my gloves on, and I'm gonna put the tourniquet on my patient. And you've had an IV before, correct?
Yes.
And is there a spot you usually like it?
I prefer my left arm.
Your left arm? Okay. Let's see if we can make that happen for you. I'm just gonna put my tourniquet on. I can tell you're pretty hydrated. Your veins are already popping out. Put my tourniquet on, making sure I can put one finger in. Good. So right now we're dilating the vein. I see a nice vein right here, and my patient is pretty hydrated. If for whatever reason my patient were dehydrated, the vein would be a little bit smaller, more fragile, and harder to find. My patient's going to be hospitalized for a few days, so I think that the forearm is a good place to put it. We want to avoid places like the hands or any joints like the wrist or the antecubital, just because of the movement. And the left side is my patient's non-dominant side, so they won't be using that one as much as they would be their dominant side. So since I did find a vein, I can go ahead and release my tourniquet. And now I'm going to open this up, drop my needle, and take my ChlorPrep. I'm going to use a circular motion on here for about 30 seconds. Get it nice and cleaned off using friction. Okay, 30 seconds has passed. I'm going to let that dry. I'm going to reapply the tourniquet, making sure that it's drying on its own, not that I'm blowing on it or fanning it at all. Keeping it as clean as possible. Everything still feeling okay?
Yep.
Okay, so when I put your IV in, you're just going to feel a little bit of a poke. You said you've had this before and you haven't had any problems with it, right?
Nope. Everything went fine.
Okay. So I'm going to go ahead and open this up. I'm going to pull down with my non-dominant hand, pulling the skin taut, with the bevel up, going in at 15 to 30 degrees. I should be seeing blood return. I see blood. So I'm gonna go ahead, advance my catheter, pulling my needle back, applying pressure, releasing my tourniquet. Now I'm getting my J-loop. I'm going to attach that. Okay, have my catheter in. I'm going to aspirate for blood, which I see blood. So now I can go ahead, and I would do 2 milliliters, but since there's some blood in there, we'll just push the whole thing in. Okay, go ahead and disconnect my flush. I'm going to clamp it. I'm going to go ahead and use some tape. Tape down my hub. Tape down my extension tubing. And then I can use some gauze. I'm going to clean up my patient just a little bit. Okay, so then I'm going to dispose of my needle in the sharps container. Anything that had blood I could put in the bio bag and get rid of that. If I was using the StatLock, what I would do is I would put some skin prep down, and I would peel these away slowly like a Band-Aid and put the lips right over the hub, making sure my arrow is towards my patient just to secure that on there. I could use a clear dressing per hospital policy. And then what I'm going to do is I'm going to document. So I'm going to document the time of insertion. I'm going to document the type and the gauge of the needle that I used. I'm going to document if my PosiFlow is capped or uncapped. I'm going to document if I have a continuous flow going. I'm going to document if I had blood return. I'm going to document the patient's response. I'm going to document if I had the clear dressing on or not. And then I'm going to document I'm totally blanking. My time, my site, I'm gonna have to redo this.